What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how to get your foot in the door in the radiology field. So this is more for people who do not do x-rays, who are not in the actual hospital, in the actual any clinic, so you're just a regular Timmy, a regular peep, just out there like, oh, I want to do that, but I'm still not in the program. I'm like probably in college, maybe like post high school. I want to, see what it's like to okay, so there's a few options I've seen now, being in my position of being on the x-ray side of things. I feel like the few options you have is you can go in there and you can do transport. You can transport patients around the hospital. So that will kind of not get you in the door necessarily in the radiology department, but just in the hospital in general. So you can see, because transport gets used a lot by like CAT scans, sometimes x-rays. So you'll kind of, over time get a gauge and be like interacting with the department, and you can kind of see from afar what's going on, and also like sometimes patients end up coding and we use them also to help out with there. You can kind of get your like just foot in the door in the medical kind of world without doing crazy amount of medical stuff, but you do get that. One is a good way. And then just recently in my hospital, they've added, I guess because of the workflow, or maybe because we have people who actually want to do it, we have the radiologist, it's called, we call the rad tech assistant type thing. That one is used mainly for a CAT scan, and occasionally we'll be like, yo, we need your help with like super big patients, or someone that's like really hard to move and stuff. We'll kind of use them. Those people strictly stay in the radiology department, so you could say they're your own personal x-ray assistant type deal. So they're not certified or anything. They're not like limited x-ray. They're just assisting you, usually via like transporting, or kind of like getting the patients from the ER room and be like, oh, hey, they need you down in CAT scan. This is what they're going to do to you. Kind of give them the basic like verbiage of what's going to go on, but they don't do contrast. They just bring. You can imagine being the taxi driver for our department. That one, if they offer that one, that'd be the best one to do, because you're actually in the department, and you could, if you have someone take you under the wings type deal, you can learn a lot from seeing the same exams being done. You can kind of learn, ask questions type deal. So you're almost like a student, but as a student, you're actually performing the exams and assisting. Being the assistant, you can't legally, you can't do that yet. So that's one thing. That one will help a lot. Other people I've seen get in the foot of the door, they'll literally be cleaning the hospital, and they'll work in the ER, another like cleaning department, just to look and see, just to get familiar with the space. I wouldn't necessarily feel like that's the best way, but to kind of get your foot into the hospital, that's one way I've seen people. They've kind of like worked their way. There's people who've been in the cafeteria who ended up pushing the button or getting into, the radiology field that way. Because like they'll be like delivering food, bringing food here, or like interacting with the actual techs, ask questions and stuff like that. That's more like you're just trying to get your foot in the door of the hospital. Because kind of like once you're like, okay, I worked for the hospital, it's kind of easier to, when later on you go and actually become a tech or CT or whatever you want to do, you're like, okay, well, you have all my like information type stuff already in the system, and you know who I am. It's kind of more easier to oblige to someone. Like if the manager pulls up a report, it'd be like, yo, this person actually worked for our hospital via someone who's never been here in their life. They'd be like, well, this person probably kind of already knows their way. Like it's little brownie points, I guess, type deal. That's one way you can get your way into our department. Other people, you'll see them go through like the phlebotomy program. That's even shorter than ours, or CNA. They'll do that. I see more CNA as most of them want to be nurses, but that's like the beginner step into that. But others do CNA and then end up jumping into our department. What else? And then there's people who are like, who work with the psych nurses, who like kind of do like the EKGs type, like keep the nurses safe type deals. Like I'm not sure what it's called, but those are also another way to kind of get your foot in the more medical side of the door. And then you have the people who are, we call them the hook of the ER. They're basically like when anyone calls, they're the kind of the receptionist head of the emergency room. They kind of know what kind of like the charge nurse is the one who knows kind of everything what's going on, but they're kind of like on the opposite side of where they kind of just, they don't know deep detail, but just kind of get a gist of the flow of the work and interacting with the doctors and kind of transferring calls, saving time type deals, you know, cutting out the middleman type deal. That's another way. Very stressful, but I've seen it, people do it and they become either nurses or X-rays. So that's another way. I've seen that. Or there's other people who do, what's it called? When they check people in, get like basic information, like the insurances and sign consents and stuff. That's another way. I've seen it done before. Or if you do security and then you end up liking what you see in our department because you're doing rounds and stuff, that's another way. But most of the time, people who end up doing security end up going to become police officers or doing other type stuff like that. And yeah, that's all I can think of for now. Hope that useful information. See you on the next one.